women plastic surgeons. The struggle is a little more for them.
For women, it is definitely more difficult. Talked about the biological clock, inherent nature of the female body.
What is that message that you want to leave out for young surgeons or people who are getting into any careers?
Most important thing, पेट में आग. Extra effort to be the best. अगर आप एक स्टिच भी लगा रहे हो तो उसको अच्छे से लगाओ. अगर आपको लगता है वो ठीक नहीं लगा तो put it again. Practice makes perfect.
Have you seen over your career a change in the kind of patients that you see or patients' expectations?
Hi everybody, I am Dr. Aditya Aggarwal. Right now I am the Vice Chairman of the Department of Plastic, Aesthetic and Reconstructive Surgery at Medanta, the Medicity, Gurugram. और मेरे साथ हैं Dr. Pooja Sharma. She is the CEO of Apar Health and my better half. We have been together for more than 35 years now. And we have had this wonderful journey together. So we will be in conversation talking about general life, plastic surgery, what are the most important things to have a work-life balance, and what is important in your day-to-day activities, and how you should live the life in the present. Welcome, Dr. Pooja.
Thank you so much, Dr. Aditya. It is so much fun to be with you today. So just yesterday, somebody sent me a joke about, how a jet pilot and an Airbus are flying together with each other, and the jet goes all making rounds and circles and loops and saying कि देखो मैं कितना कुछ कर रहा हूँ, and the Airbus guy says कि देखा तुमने मैंने क्या क्या किया. So the jet says कि क्या किया तूने? कह रहे मैंने उठ के गया, मैंने केक पिया, खाया, चाय पी, लोगों से हेलो की, और फिर मैं वापस आके वहीं बैठ गया. So there is a difference in life, how things become important or unimportant as we grow. But one thing that I have seen over years that I have been with you is that exercise, fitness, balance, and excellence. These three, if you ask me, are the terms that define you. So how is it that you manage this throughout? And I've seen this even happen during residency, that you would go out and play.
And I remember you would crib if I had to go for exercise and not go for the movie because I've not had my exercise fill today. So I think it's a very interesting question, Pooja, because I feel for me that half an hour or 1 hour which I spend with myself, whether doing exercise or whether playing a sport, that for me is the Zen space which I have. It gives me, it's the meditative start of the day. It gives me a peace of mind. It gets me ready for the daily grind, you can say, or the daily routine which you normally live through. Especially as a surgeon, I found that having some sort of an activity beyond my surgical field, beyond what I practice, जो हम करते हैं, तो मेरे को एक वो सुकून बहुत ज़रूरी है. So चाहे मैं 10 मिनट की स्किपिंग करूँ, we have a small gym at home. So अगर मेरे पास टाइम नहीं होता है तो I just go up into my room and just do 15 मिनट की exercise, stretching. So that gives me a good start to the day. So whatever the time, whatever the day, so I always love to do it. And it has sort of inculcated in me, in my daily routine. I still remember that during my 10th and 12th study period, I used to study till 1 o'clock, then go for a jog, and then come back and sleep. तो सब कहते हैं बेवकूफ़ है, मतलब तुम रात को भाग रहे हो, रात को कर रहे हो. But the point is that everybody has their own routine. To everyone, every time may not be the right time. So मेरे लिए ये था कि मेरे को जब टाइम मिले, I'll catch up on sleep or do my exercise beyond studying and doing the other things which you need to do to become a doctor.
Yeah, but today's world, the world is actually in that 10-15 minutes that they have, which are free or their own, will see something on a reel or they will see something on whatever the newer TikTok or whatever other thing is there. So what do you suggest to them? Is there a reason to not do that versus do the exercise? Does that?
So I wouldn't say like that. I would say that you have time for everything, provided you're able to manage the time well, right? So if you tell me that in 24 hours you can't take out half an hour for yourself, then you're abusing your body. I would feel that we become slave to a lot of illnesses like diabetes, hypertension, and then stress can be a big factor. And when you do all these activities, they are de-stressful. They de-stress you. And then you can live you can have a longer innings. The chance of burnouts are less. And when you're wasting time in just seeing a movie or just seeing these short reels, so it gives you the dopamine hit and then there's a sudden drop. And there's nothing to, jack you up. And there's nothing substantial that you have done except for watch these, Insta stories or whatever. But let me also tell you that digital media is there to stay. I have been a late person to join this bandwagon, but I realized that to be of relevance in today's world, you need to be on the digital platform. But yes, the age at which you join and what kind of post you're going to create will be different. But yes, you need to be there, but you need to divide the timeline. I know it's easier said than done, because once you go on Instagram, so that's why I don't go on Instagram, because once you go on the Instagram, you just keep scrolling, because it's like an addictive thing. It's something you're enjoying, just small bits of stories and everything else. So I think a balance needs to be maintained. It is not that you do this and totally don't know do that. So you need to find time to do everything. That is what I would stress.
I know. So the work-life balance for sure is something that you've always spoken about. I think even at many conferences I've heard you speak about work-life balance. Or as a friend of mine says, work-life equilibrium. कि कभी work थोड़ा ज़्यादा, कभी life थोड़ी ज़्यादा. So how do you really manage to do that? And in this time of work-life balance, how do you manage to create that balance?
So I think it's important that you realize what is important for you. It is not what the other person is feeling. What suits your body, what suits your routine. That's very important. I still remember those days when I used to be, right in the early stage of my career, because as you know that we are very busy as plastic surgeons, a lot of emergencies come in. And I started off as a reconstructive microsurgeon. So I used to have my squash kit in my car, because sometimes you get free at 5 o'clock. The sports complex used to open at 6. I still remember going to the sports complex first, having a game, taking a bath, then coming home, just changing my clothes, packing up the breakfast and going back to work. So that you can do when you're young, but not at this stage of my career. But now I space myself well. I have a good team with me. And I space my surgeries in a way so that I can do justice to the patients. And I like to give them the time. And it's important that you deliver the best of your capabilities to the patients, because ultimately the patient is a human being, and you wouldn't want that to be done to you if you were the patient.
And I think this is the other third word that I use to describe you is excellence. And I've seen this being repeated to even the children, saying you do the best you can. It's not necessary, that you're going to top, but you must put in your best effort. You must put in your, keep in mind. And I've seen you talk to residents, think about it from the patient's point of view. Do not just think of it as a step A, B, C, and SOP. So what is that message that you want to leave out for young surgeons or people who are getting into any careers per se?
So I think the most important thing which I like to say is पेट में आग, that that fire in the belly. That's very important, because you need to strive and make that extra effort to be the best. अगर आप एक stitch भी लगा रहे हो तो उसको अच्छे से लगाओ. अगर आपको लगता है वो ठीक नहीं लगा तो put it again, try to do it again. Practice makes perfect, and that's very important. And you may not be able to do all kinds of various surgeries, but whatever surgeries you choose to do, you should try and excel in them. Try to get the best results. Read a lot. Like, there are so many publications. And then the other thing which I would like to tell my younger colleagues is, please do publish, document your cases well, take standardized photographs, keep a good record keeping, get the patient feedback, because in today's times, it is patient centricity which is the most important. And in aesthetic surgery, we talk about shared decision making. See, in trauma and many other cases, there are standardized protocols, and you don't have that much time in trauma cases to discuss the decision-making process, because you know what needs to be done. But the family needs to be made aware of that. But in aesthetic surgery, all the patients who come to you should know that what are they expecting out of the surgery. You have to calibrate their expectations. That is the most important thing. And then it has to be a shared process, shared decision-making. You may be thinking that I will do a great surgery and then this will be the result. The patient may not want that. So it is very important to talk before the surgery rather than having to talk to the patient after the surgery when the patient is not happy.
Yeah. So while you're talking about this, I was just thinking about how, over time, when I met you first, you were still a medical student, and then from there to a general surgeon, and then to a plastic surgeon. What is the message that you would like to leave to younger medical, students, whether they are just doing their medicine or whether they are just general surgeons right now? How to choose, and how did this life happen to you? So how did plastic surgery happen?
So plastic surgery, I think there's a lot of serendipity involved in this, because I did my MS General Surgery. I wanted to become a gastro surgeon. I wanted to become a cardiothoracic surgeon. I wanted to become a urologist. Then one of my senior colleagues told me, बॉस अगर आप सब कुछ बनना चाहोगे तो कुछ भी नहीं बन पाओगे. So you need to focus on one particular specialty and then work towards getting into an MCH seat. So as things panned out, I decided that I would just take a break, in the sense I'll practice for 1 year after doing my MS, because there was no clarity in my mind what kind of a super specialist exams I need to give. And I cannot be competing for 4 different specialties because there's a lot of things to study. And during those times, the exams used to be centered on the specialty you choose. So if you don't know the subject, the chances of your getting selected are very, very few. So as things happened, I decided to go for plastic surgery. And as you know that when I was practicing, so I was stuck up in a emergency case, and I was to catch a train to go for the MCH entrance exam. So one of my friends who was also supposed to go there called me up. He said कि भाई हमें चलना है. मैंने कहा भाई हम चलेंगे तो सही, but मैं तो फंसा हूँ यहाँ पे सर्जरी में. So then we had a telephonic discussion, and then you said I'll pack up your bags. He can pick up the bags, and then he can pick you up from the hospital. And then as things panned out, we reached the railway station half an hour late. We thought कि यार हिंदुस्तान में तो पता नहीं ट्रेन पहुंची है टाइम के नहीं पहुंची है, तो हमने कहा चलो अंदर जाके प्लेटफॉर्म पे देखते हैं. तो जैसे हम प्लेटफॉर्म पे पहुंचे तो ट्रेन जा रही थी, सो हमने दौड़ के ट्रेन पकड़ ली. सो इट वाज अ भाग सिमरन भाग मोमेंट फॉर अस, and we both caught that train. And unfortunately I got through plastic surgery, but my friend could not get into his cardiology exam. But I think there is a lot of destiny which is always there, and I think you have been an important part of the whole life we have lived. And I think as destiny decides most of the things for you, but you should be aware about the opportunities that may just pass by you. So you have to be mindful of the things around yourself. And when the opportunities come, you need to grab them.
Yeah, that is so true. But now I see a lot of youngsters are confused about whether, they should go abroad. There is a group of youngsters who wonder whether they should work in corporate hospitals, people who want to work in whether they should go for academic units, whether, a smaller town practice is good for them. So there is a lot of confusion in young doctors' minds. And many of them are even ready to let medicine go because they think the struggle is just too much. Even after doing their MBBS, they're saying कि रहने दो अब नहीं होगा. So what is your message to them?
So I think most important thing is you have to be clear in your aims and goals in life. And I know medicine is a tough subject, and if you're there by mistake, then please choose another career, because you can't be in medicine and not working hard, or at least trying to be your best. So the important thing is you have to love what you're doing, because if you don't love your profession, you don't love what you're doing, then obviously it will be a struggle, everyday struggle for you, and the very high chances that you will have a burnout. So regarding your question about people wanting to go out, let me tell all my younger colleagues that India is on the threshold of becoming a superpower. The next 15 to 30 years would be India's. So I think for you, this is the right time to be in India and make India what it can become in the next 15-20 years. And your talents can be used in the country itself. See, let me tell you, when you go out to any country you may want to go, to America, to Germany, to the US, to Australia, UK, you'll always be a second-class citizen. You'll be never be the primary citizen of that country. And you will be always looked down upon. And you will always face competition, and unfair practices would be there, which you may feel are unfair because they would like to promote their own
talent
and their own people. So I think for you, it's important to realize the struggle is going to be
there everywhere.
So many years, and then you will have a lot of time when you will feel very lonely out there because your family and support structures are not there. And if you are going to be there, then you have to live like them. Recently, I heard a post that one of the mayoral candidate was eating with his hands, and some Democratic Republican fellow said that if he's going to be eating with his hands, that is very unclean, and he should, when he's in here, then he should be eating like we eat. So you can't be eating with your hands. Then go back to your country. So I think we have seen a lot of these kind of things happening. So I think if you want to have a good practice, India is right now at a stage where you can earn good livelihood, you can have a good practice here, whatever your field of practice. And in surgery, obviously the struggle is longer, but if you know what you want in life and what you want to do, you have to work towards it.
So I'm going to ask you one question that I have, in conferences being asked by many young women plastic surgeons. And the struggle is a little more for them, right? The one factor is that, of course, plastic surgery and any specialty surgery is a long career path. And sometimes if you have a break, so it becomes even longer. And saath mein, the biological clock is ticking. So there's pressure to get married, there's pressure to have a baby, and then to compete equally in a world of men in a surgical field. Though aesthetics, I know that you have many residents who are women, and a lot of women surgeons we are seeing at conferences. What is your, if you can say, you can't put yourself really in their shoes, but any suggestions and advice or guidance that you have for them, how to balance this part?
See, I can tell you this, that I definitely feel very strongly that for women it is definitely more difficult. Like you talked about the biological clock, because that is the inherent nature of the female body. That yes, and you want to have a child. Most women would want to have a child once they get married. So I think that is definitely, for some women, they may find this as a roadblock, and they may find that कि बच्चा पैदा करके parents को दे देते हैं, and then you suffer from that guilt of not looking after your own child, not seeing your child grow up. So I think it is definitely a thing which the person who is taking a surgical career need to think about. If you have good support systems, that's the best way to go about it. You can have your family members, or maybe your husband can be more supportive of what you want to do. But I know for sure that for two people who are both surgically inclined and are partners, like in our case also, so you decided to take a back seat because you would have had a flourishing gynecological practice. You already started having a good practice when we were moved to Delhi. So then it was a decision which we took jointly about, one of us stepping back. I was willing to step back and
No, I wasn't willing to let you go. No, I'm the one who wants to do the golf. I'm not going to let you do the golf.
So the point is that obviously as a team you decide what is best for you, but I definitely feel that yes, for women it is more difficult, especially you would be having your child right the prime of your surgical career. Either you would be a resident or immediately post your residency. So you need to take that time out, and you also want to be in the mix of things, because as time passes, you also lose touch, and then you always feel that you are lagging behind so many things. So I think for women, I definitely agree that it's a double the effort. But also they do have a certain advantage. Their soft skills are much better. Patients relate to them much better. And many of the women patients, they feel more comfortable with a woman plastic surgeon because of body contouring and many other aspects of human. And they feel more connected because they think alike, right?
So
that's one advantage they already have.
Yes, that's true. So we have some advantages. So coming to my last question is more targeted towards the patients. So have you seen over your career a change in the kind of patients that you see, or patients' expectations from surgery? Has sort of social media changed that expectation? Do you want to give a message to the patients that when they are choosing a surgeon or they are choosing somebody to do that procedure, and many of them don't come to plastic surgeons, how should they go about processing this?
It's again a very good question and a very important one for the patients. See, like when you go and buy something, you do your homework, right? Suppose you're buying something expensive, you see 3-4 products, कहाँ से कितना मिल रहा है, क्या है इसके, क्या उसके star ratings है. So likewise, I think when you choose a surgeon, you have to do your homework. First and the foremost thing is that the surgeon has to be well qualified. There's no harm in asking the doctor about their degrees, their certification, their affiliation to the national societies. Because once you're a member of the national society, that means you are a verified, trained plastic surgeon or aesthetic surgeons. Like for aesthetic surgeons in India, IAPS, or the Indian Association of Aesthetic Plastic Surgeons, is the regulatory body in terms of verifying and certifying aesthetic surgeons that they are of good standing and have the necessary caliber to practice aesthetic surgery. So ask for the membership, and then we have this authenticity shield, which is given to all our members to display. So that is another surety for a surgeon that, okay, this particular person or a doctor is well qualified. So you have to do your homework, and then you can ask your surgeon about some pre and post op pictures. You can ask the surgeon to let them know the name of few of the patients you have operated for a similar surgery, and if they're willing to be able to talk to them, because for them that gives the most confidence boost, the immediate confidence boost that yes, this doctor has done this kind of surgeries and the patient is happy with the outcome. So you have to have a grid of patients who are willing to talk to your future patients and in a more realistic manner.
Yeah. when I see you do that, especially for your breast cancer patients that you're actually using. So is there any surgery that excites you when you go? कि आज मेरे OT में ये वाला case है. This is going to be fun.
Yeah, that's very difficult because see, I like to do a lot of different things, and I like to keep shuffling amongst.
I know your OT days also are mixed with a lot of interesting.
Because we have a good team, so we be doing a microsurgery, aesthetic surgery, and as well as a major reconstructive surgery in the same day. So I think I would say that the surgery which I like doing is a rhinoplasty, especially the Indian nose, because I feel that that's a very difficult nose to treat and get a good results long term. That is one part, and it can be very taxing mentally because sometimes the noses can give you a lot of trouble. So I think nose surgery is one which keeps my antennas up, and I am actually on my toes when I am doing a rhinoplasty. Otherwise, I like to do almost any kind of surgery. Reconstructive microsurgery or raising a flap, and little thigh flap or a fibula flap still gives me excitement, and I still love to do a lot of microsurgical work.
And your interest in the nose is definitely, I have a story to tell about that. And other than the fact that the lovely paper that you've written on Indian noses and rhinoplasty, is that you remember the time when we were still early marriages, and you actually complimented my nostril to have been a teardrop nostril, and it took me so much time to understand, is this a compliment or is this, what are we talking about?
So exactly. So I think I always had this aesthetic sense in me, and when I looked at your nose, I thought, this looks like a perfect nose to me. So there you go. So I think you have to have the innate aesthetic sense in your head when you're going to become an aesthetic and plastic surgeon. Everybody doesn't have it. Some people develop that skill, but I think if you have that innate aesthetic sense, then you're bound to become a good aesthetic plastic surgeon.
So on that innate sense of my beautiful Indian nose, I think I'll thank you so much, Dr. Aditya, for such a lovely conversation. And I really look forward to having even more exciting conversations with you soon.
Thank you, Dr. Pooja. It was a pleasure having you here with me, and it was nice talking to you.